Hello everyone, I am Vijay Kevlani, Assistant Professor of Pharmacology, LG Institute of Pharmacy. Once again, welcome to Pharma Ignite. In today's session, we are going to talk about antihistaminic drugs. Now we have already discussed the pharmacological actions and pharmacokinetic of antihistaminics. In this session, we will talk about toxicity as well as second generation antihistaminics and uses of these antihistaminic drugs. Right? So let's start our today's session, that is antihistaminic drugs, side effect and toxicity. So side effects of first generation H1 antihistaminics are frequent but generally mild. Individuals shows marked difference in susceptibility to side effects with different drugs. Some tolerance to side effects develop on repeated use. Right? So the point is ultimately the side effects are mild. The most important side effect of first generation antihistaminic is they induce drowsiness, they cause sleepiness or they cause sedation. Right? Apart from that, other side effects are also there, but this is the most prominent effect. Now it also varies with individual. It also varies. There are three components, right? Very first is their affinity of the compound to H1 receptor in brain. Second is their penetrability to blood-brain barrier, and third is an individual. So it varies patient to patient. Okay. Moving on, sedation, diminished alertness and concentration, lightheadedness, motor incoordination, fatigue, and tendency to fall asleep are the most common. Objective testing shows impairment of psychomotor performance. So whenever objective testing is performed, ultimately due to this drugs there is huge sedation. Patient should be cautioned not to operate motor vehicles or machinery requiring constant attention. Alcohol synergies in producing these side effects as do other CNS depressions. Few individuals, however, become restless, nervous, and are unable to sleep. So as H1 antihistaminics are having sedation property, they should not be used before driving or operating any heavy vehicle. Right? Apart from that, alcohol is also having this sedation property, and hence if alcohol and antihistaminics are taken together, they may produce additive action of depression or sedativeness. Right? Moving on, second generation compounds are largely free of CNS effects. Regular use of conventional antihistaminics is not advisable in children because the CNS depression property may interfere with learning and academic tasks. Dryness of mouth, alteration of bowel movement, urinary hesitancy, and blurring vision can be ascribed to anticholinergic property of older antihistaminics. Epigastric distress and headache may be felt. Right? So this all side effects are due to anticholinergic property, as we have seen that antihistaminics are having high, low and absent or mild anticholinergic action, and this anticholinergic action may produce this kind of side effects too. Local application can cause contact dermatitis. Some drugs like hydroxyzine, cyclizine and fexofenadine are teratogenic in animals. Teratogenic means they can produce damage to fetus, means whenever or if pregnant lady consume these drugs, ultimately it may produce teratogenicity, means damage to fetus. But there is no evidence of excess malformation in human. Caution is nevertheless to be exercised in prescribing an antihistaminic during pregnancy. Acute overdose produces central excitation, tremors, hallucination, muscular incoordination, convulsion, flushing, hypotension, fever, and some other features of belladonna poisoning. Death is due to respiratory and cardiovascular failure. So whenever ultimately a high dose of histamine is consumed, this kind of life-threatening condition may occur. The second generation antihistaminics may be defined as those H1 receptor blockers marked after 1980 which have one or more of the following properties. So the properties of second generation antihistaminics are absence of CNS depression property, higher H1 selective, no anticholinergic side effects, Additional anti-allergic mechanism apart from histamine blockage are some also inhibit late phase allergic reaction by modifying release or action of leukotrienes, platelet activating factor and cytokines. As per an international group of experts, no compound developed so far merits labeling as third generation antihistaminics. These newer drugs have the advantage of not impairing psychomotor performance, produce no subjective effects, no sleepiness, do not potentiate alcohol or benzodiazepines. Some patients do complain of sedation, but incidence is similar to that with placebo. However, they have a narrow spectrum of therapeutic usefulness which is limited by the extent of involvement of histamine in the disease state. Their principal indications are allergic rhinitis and conjunctivitis, hay fever, pollinosis. They control sneezing, runny but not blocked nose and red watering itchy eyes. Urticaria, denographism, atopic eczema. Acute allergic reaction to drugs and foods. The SGAs have poor antipruritic, antiemetic and anti-tissue actions. Uses. So all antihistaminics are used in allergic disorders, other conditions involving histamine release, pruritus, common cold, motion sickness, vertigo, pre-anesthetic medication, cough, Parkinson, acute muscle dystonia, and as sedative, hypnotic, and anxiolytics. Thank you everyone. Please like, share and subscribe our channel Pharma Ignite and don't forget to hit bell icon for latest updates. Thank you.